Hi everybody, I'm Dr. Mufid with Mufid Clinic of Chiropractic, and today we're here with Dr. Cole here talking about a very, very, very important topic, and that is COVID-19, which everybody is very nervous about. And I wanted to do this video specifically with Dr. Cole because he will tell you a little bit about himself, but he's an amazingly knowledgeable pathologist here in Boise, Idaho. But also I wanted you to hear valid and research information from someone who's an expert in this, and not from your friend in the aisles at Costco covered with plastic on their head and all the stuff that you hear is crazy. So here's Dr. Cole. Dr. Cole, thank you for doing this little interview video for us.
Pleasure to be here.
Will you let our audience know a little bit about your background? And
Certainly. I'm a board-certified pathologist. I'm trained in anatomic, clinical, and dermatopathology. I trained at the Mayo Clinic, and I was there for 5 years doing all aspects of pathology in high volume, seeing the weirdest cases from around the world. And I have been in practice here in Boise for 17 years. Have run an independent private laboratory. We see about 50,000 patients a year between biopsy work and blood work and women's health work and microbiology work. So we serve the community in an independent fashion, and we see lots of disease across the spectrum of human disease. I've been following COVID as you have, and the concerns that are out there in the community, and I'm here to answer what I can. We do a lot of different testing here in the laboratory, and we've been trying to get some of the testing up and going, and have been running into some reagent and regulatory roadblocks and whatnot, and we have a couple of very fascinating options that'll be online very quickly here. So yeah, here to answer your questions and answer your patients' questions about this current novel outbreak. It's a very unique situation in our generation.
Yeah, I've never seen anything like it, and it's unprecedented. But so just kind of in simple language, let everybody know what COVID-19 is, and then basically let everyone know what they should not worry about, and what is this, and put it into perspective for everybody.
Certainly.
Yeah.
So COVID-19 is a type of a virus. It's an RNA virus, and there are a lot of different varieties of viruses, and this is a unique type of virus. Coronaviruses have been present in humanity for lots of years, and some people in the past have had types of coronavirus that cause the common cold. It's one of the many viruses, adenovirus, coronavirus, etc., that cause the common cold. This is a new strain of virus that has recombined reportedly in nature and has caused an outbreak. Compared to other coronaviruses, this one is more virulent. It's more easily transmitted through the respiratory route and droplets and close human-to-human contact. Compared to say the influenza is usually a one-person-to-one-person contact in terms of spreading influenza. The unfortunate thing we're finding with corona is it's basically 1 to 3 to 1 to 4 person spread. So that's why in the world we're seeing the doubling rates happen so quickly right now. It's very contagious. The majority of people who get it, and especially our younger individuals in our population, they may only have a mild cold from it and may not manifest. And the challenge we're having right now is truly getting the prevalence of this disease, because it may silently be spreading because it's so contagious person to person to person. The challenge we're having is those who are immune compromised and the elderly and people who smoke are at much higher risk from complications, respiratory complications from this virus. Now, because it's a virus, you can't use antibiotics to treat it, and technically, no one in the world prior to the emergence of this virus, no one has immunity to it. People say, oh, I'm immune to it. Well, you may have a good immune system, and that's what we're shooting for, hoping that our population stays healthy and has a strong immune system. But because the virus hasn't been around, we've never had the opportunity to develop antibodies against this virus. And that's what we want our bodies to do, is we want a healthy immune system that will bind and attack the virus itself, produce antibodies, induce an immune response to clear the virus.
I see. Excellent. So, speaking of the immune system, it's like we say here, it's not about the virus, it's about your immune system, what your body can do with this once it enters your body. So earlier we were talking about nutrition, we even talked about the atlas, the cervical adjustment, and its effect on the immune system, and you talked about age groups, you talked about where you live, and how the effect of the sun is on your body and vitamin D production.
Yeah, this is an interesting point, and I wish we were hearing a little more of this from our public health officials from the pulpit and whatnot. In the winter time, the further north we live, and generally above the 37th parallel anywhere in the world, or below, depending on when your winter is, you could run outside naked every day for 4 months, and every day could be sunny, but you cannot synthesize enough vitamin D in your body to have adequate levels of vitamin D. So in the winter time, our vitamin D levels do this consistently until the end of winter and spring comes, and then we get more sunshine and we synthesize vitamin D in our skin, and then our D levels go back up. So if you look at the cycles of viruses, cycles of influenza over the decades, they peak when our D levels are the lowest. And D is not just a vitamin, but acts as a pro-hormone in the body and regulates your hormonal system, but most importantly, regulates your immune system. So if you have healthy vitamin D levels, studies across the board throughout the world have shown the higher your D level, the less respiratory infections you will have of all types, a common cold, influenza, etc. So instead of the rush to the grocery stores for toilet paper, the most important thing we could be doing right now is making sure our vitamin D levels are adequate. So this, not this.
Yes.
This is important, but this. Hygiene for sure.
Absolutely.
However, all of us are, and in Idaho especially right now, are low on D unless we've been supplementing throughout the winter.
So you recommend supplementation of D as well as some of the other ones? That
and I mean vitamin C is a good T cell upregulator. Some zinc certainly, vitamin E as we discussed. Some studies show that vitamin A, but you've got to be very careful with A because you can overdose on A.
Right.
Vitamin D, a lot of doctors are scared of it because they're like, oh, I don't want my patient to become vitamin D toxic. Rare as hen's teeth to be D toxic. I take generally 10,000 international units a day in the wintertime. Some patients, may take 5,000 during the outbreak. I'm taking a little bit more. I monitor my D levels and I try to stay in the optimized peak of the range, of the healthy range of having vitamin D. But as I mentioned, some of those other vitamins are very important as well in terms of the goal here is the virus is prevalent, the majority of us are going to get it. The patients who are at risk, I have asthma, I'm an at-risk patient. The patients who are at risk do need to be careful. We do need to practice the good hand washing, elbow bumps instead of handshakes right now. Not touching our faces, being very careful in big groups in public, trying to avoid that right now. That's important.
Yeah.
But also nutritional supplementation, keeping your body healthy and keeping your mind healthy.
Very good. Yes. Stress.
Stress will mess your immune system up faster than anything.
So true. I tell my patients all the time. It rises your cortisol level up to the roof, which then causes. And so it's important. That's one of the reasons I wanted to do this interview, to let people know that, put things in perspective, keep the stress level low. Now tell us about the research you had read about the cervical manipulation and its relation to.
Yeah, and this was kind of an anecdotal finding. I was studying chronic fatigue. I ended up with an illness recently that put me into a downslide for quite a while. And in some of the chronic fatigue forums, and they don't know why or what the mechanism is per se, but some patients who had gone in and had, even a surgical procedure on their spine, when it readjusted their neck, their T cell levels went up, their natural killer cell levels went up. And so it was just kind of this little tidbit I found, and then you informed me that there were some patients in the flu outbreak in the 1917, 1918 Spanish flu that found that same benefit after chiropractic adjustment. Now, that's not my realm of expertise, so I'm going to have to defer to you for that, but I've anecdotally seen that there may be a modicum of science behind that. The mechanism we don't know.
And our viewers can also research this themselves during the 1918 pandemic. And it is documented that the vast majority of patients who went to see their chiropractor at the time, they survived it a lot better than anything else that was around at that time. Of course, we didn't have modern medicine at the time, but it helped them stay alive, and that is documented. And as you said, we don't really know how this happens, but it happens. So in the future, somebody will
find the science behind it, but it
Yeah.
has been shown that it does boost T cell levels.
T cell levels, which is super important right now.
Yeah, your natural killer cells are critically important for attacking any viral illness. So yeah, there's plenty of things we can be doing. Obviously, follow the guidelines that the government, local, state, federal are giving us. That's important, very important. But the one thing I would like to get out there, and I wish more people were hearing, is take care of your nutritional health, take care of your mental health. My wife earlier today, she's sitting here, we were doing some emailings, we're trying to help the community do as much testing as we can, guiding, directing people where to go, and I was a little bit stressed. She said, stop, do your box breathing. Awesome. Count 4, breathe in, hold 4, out 4, relax.
Yes.
And any type of relaxation type breathing, go online. People are going to be home for a while. Get into a yoga practice, get into a mindfulness practice, get into a pranayama, whatever it is, anything that you can do to slow those feedback loops of stress. Keep your cortisol low. The higher your cortisol levels, the more stressed you are, the less functional your immune system is.
Absolutely. And turn off the darn news.
Yeah, don't listen to all the panic and the chaos.
Yeah.
Yes, the disease is here. Yes, it will spread. Yes, there will be bad effects to some people, but if you're taking care of yourself in those calm, rational ways, this too shall pass. It's going to be with us for a while. Again, we're trying to develop our natural immunities to something our body hasn't seen before. We're trying to develop a population herd immunity to this, and it will slow the spread of the virus. If we're willy-nilly going out in large groups, and if you're not feeling well and you're exposing your other friends, we can cause this disease to spike way too fast and overwhelm our healthcare system.
That's right.
By doing the calm, rational things, following good nutrition, good mental health, good guidelines, etc., we can get that curve flattened and keep this disease from spreading too quickly.
That's awesome. Well, Doc, I think that's all we got time for. I wish we could talk about this a little bit more, but I want to thank you for doing this.
Elbows for now.
And thank you so much for watching this. If you have any questions regarding COVID-19, you can call our office, or, well, I don't want to overwhelm you. Maybe they should call
We're pretty
you.
overwhelmed at
They're
the moment,
overwhelmed. Don't call them. Call us at 208-323-1810. If we cannot answer it, then I would have to call him.
Yeah.
And then we can get the answer for you, or you can email us or look at our website. But please, please, please do not stress out, and just follow the guidelines, wash hands, distance, nutrition, adjustments, and vitamin D, very important. Like you said, toilet paper important, this is much, much more important. Thank you for watching, and have a great day, and stay healthy.
Be well.
Be well.